Coming up on Bloom, meet a man changing the world one haircut at a time. Plus, I'll introduce you to an author that will help you reimagine your next chapter in life. And the VA is expanding its disability benefits. Bloom, presented by Lifeguard Imaging, starts now. Welcome to Bloom, presented by Lifeguard Imaging. I'm Gail Guayardo. Thank you so much for tuning in. All right, let's kick things off with a look at what's trending now. Harvard neuroscientists are exploring the science of acupuncture. The hope is to use the ancient technique to treat inflammation. Right now, mice are being used for this research. The next step will be to conduct clinical testing in humans with inflammation caused by real-world infections like COVID-19. And that's what's trending now. Later on, we'll hear from a man who spent his life in and out of prison, who is now a productive citizen, giving back to his community.
It's a very tough road. I grew up battling addiction at a very young age, come from a broken home, and that's when I found my life really spiraling out of control.
Plus, we'll learn about the VA's new expansion for disability benefits.
This could affect an estimated population of up to 3.5 million veterans.
Now we catch up with our doctor about the rollout of vaccines for kids. The doctor is in. The nation's largest health philanthropy group is urging vaccine rollouts for kids. Dr. Gierder Malia with the Robert Wood Johnson Foundation joins us now. Welcome to Bloom.
Great to be with you.
Before we talk about the rollout for kids and educating parents, can you talk to me a little bit more about the Robert Wood Johnson Foundation and its mission to build a national culture of health?
Yes, a culture of health for us means a society in which everyone, no matter who they are, where they live, where they grew up, has a fair and just opportunity for good health. We've seen during the COVID pandemic that we have an unequal society. And when we face something as a society, there are certain groups that bear a disproportionate burden. So whether it's with COVID vaccines or access to healthy and affordable housing, we want to make sure to close those gaps.
So speaking of COVID-19, what is the latest health and safety data on vaccines for children ages 5 to 11?
As most folks know, a vaccine, a COVID vaccine, the Pfizer vaccine, has been approved for use in 5 to 11-year-olds. And we really believe that this is a significant step in the fight against COVID and getting us closer to an end of the pandemic. The data have shown that the vaccine is both safe and effective. What does that mean for kids and families? Fewer infections with COVID, less transmission of COVID in the household, and a safer community. Hopefully it gets us closer to kids having a greater sense of normalcy in their neighborhoods and in their schools.
And historically, as parents, we turn to our pediatricians as a trustworthy place for information. But now, health centers, pharmacies, hospitals, and schools are trying to reach children in all neighborhoods.
Yeah, as a family doctor and as an uncle of two 10-year-old boys, I know parents are really just trying to make the best decision they can for their kids. And you got it exactly right. If you have questions or concerns, the best person to talk to is your pediatrician or your family doctor. They can provide you the most accurate and the most timely information. As you said, the vaccine is going to be given at those doctors' offices, but it will also be available in clinics and schools. Schools are really important because kids are already there and parents don't have to take time off from work for them to access the vaccine. So schools are critical. We've heard from parents that the thing they're worried most about is not being able to get time off from work to get their kids vaccinated.
And since you are in communication with parents, what other questions do they have about the vaccine?
So parents wonder, what are the side effects? And what we've seen from the trial data is that the most common side effects are pain and swelling at the site of injection. And for some kids, some fatigue or fever that lasts for maybe 1 to 2 days. So very minor symptoms. The trial did not show any cases of myocarditis or inflammation of the heart. And when the advisors looked at the data, they said the benefits clearly outweigh the risks. I think parents need to remember that COVID itself is riskier to kids' heart than any side effects from the vaccines.
That's very interesting to know. We only have about, we only have about a minute left, but I did want to ask that obviously you're a big advocate of affordable childcare and paid time off as a way to really get kids vaccinated. I mean, because like you said, if a parent can't take the time off, then they can't get their kid vaccinated.
That's exactly right. And there are really good studies showing that when parents have access to paid time off, it increases rates of immunization, and it can also decrease the rates of viral circulation in the community. Those studies were done on flu, but they are probably relevant to COVID as well. And particularly for parents of kids of color, those kids are 3 times more likely to be hospitalized from COVID. So having access to paid time off through employers or through government programs is critical.
Well, Doctor, I really appreciate you joining us on Bloom today and sharing all this valuable information.
Thank you so much for having me.
We'll be back with more Bloom right after this. You're watching Bloom, presented by Lifeguard Imaging, saving lives through early detection.
The following portion of Bloom is sponsored by Lifeguard Imaging.
Welcome back to Bloom. November is Pancreatic Cancer Awareness Month. Pancreatic cancer is very personal to me and also to our next guest. Joining me now is Frankie Maldonado, the Director of Operations with Lifeguard Imaging. Welcome back to Bloom, Frankie.
Great to be here, Gail. Thanks for having me.
So, frankly, sadly, we lost 2 very important men in our lives, the men that we credit for who we are today. And we both lost our dads to pancreatic cancer. And since that happened to you, you've made it your mission in life to save lives through early detection and this innovative scan that's offered through Lifeguard Imaging.
Yeah, again, as we discussed before, it is personal, and I know how personal it is to you as well. Yeah, when my father died, it's funny how this has come full circle, because I didn't put it together how I was educated on the fact that these scans that they took from him, for him, when he asked them to see inside of his body, produced thick slices where they could create gaps, and his cancer that he told them to try to find within the pancreas, they missed. And when they told him he was clean, he was relieved temporarily, because 10 months later, they went inside for what they thought was going to be a different form of surgery. They found the cancer at the head. The head of the cancer was at the tail of his pancreas. It had spread throughout his body. They closed him up and he was gone 6 weeks and a few days later, and it was horrific. So knowing what we can now do, and the fact of the matter is, there is no screening for pancreatic cancer. In fact, after my father's death, they told me, my older brother and I, they said, boys, do us this favor, make sure you get your blood work done twice a year and have them check your lipase and amylase levels, which are directly connected to the pancreas and insulin distribution. It's kind of like the PSA levels for our prostate. It's a shot in the dark, but it's better than nothing. Well, we have with this scan at the facility I worked at and another company before Lifeguard, we have found pancreatic cancer pre-stage 1 and saved a woman's life, and it's a game changer. So we have that capability, and just to think that people now have a chance against the deadliest of cancers is pretty remarkable.
Yeah, just to listen to what you say, it seems like pancreatic cancer is very difficult to diagnose, but if treated early, if you can find it like you can with Lifeguard Imaging, that's when you can give people like my father and your dad, more life on this planet.
Well, it gives them a chance, and that's the biggest key. And you said it, if you can find any of these deadly diseases early enough, there's a possibility to survive. And that's all that it's about, is once we have the chance to see it, we can take the steps, eradicate it, treat it, and hopefully survive it.
And you and I are talking about pancreatic cancer because it's Pancreatic Cancer Awareness Month. It touched both of our lives. But this scan can reveal so much about what's going on inside your body.
Yeah, and the pancreas is the one thing we're speaking of. We're both wearing purple. We have the ribbons on for Pancreatic Cancer Awareness Month. But we are seeing all the other internal organs, from the lungs, the liver, the kidneys, the spleen, everything within the torso. So pancreatic cancer is not the only cancer that we're able to detect. And of course, the deadliest of all the diseases in the world is cardiovascular disease. And we have the ability to look inside the arteries of the heart find the blockages and save lives from that as well.
Now, I experienced this scan on a personal basis, and I will say it is so incredible coming to your office. It's beautiful, it's efficient. The scan itself, it's in a big open area,
Right.
and it's quick. I mean, you're getting all of this information in a matter of minutes.
And again, 4 years doing this, I still marvel at the fact that we can do it as quickly as we can and get that information in about 6, 7, sometimes 8 minutes, and you're getting this great evaluation of what could be going on inside of your body. All the credit to our doctors of radiology. They're amazing at what they do.
And then you take this information and then you can give it to your healthcare provider and start taking actionable steps to save your own life.
Well, that's the thing. You can formulate a strategy, and with your doctors, we tell our patients, take the information, give it to your doctors, and you now have a chance. If something's going on and you now know about it, there's multiple ways that people can treat it, hopefully, and get you to a healthy state.
Well, we're so excited that you're in the Tampa Bay area. This is really incredible.
Thank you, Gail. We're happy to be here.
And early detection truly does save lives. So now's the time to call 813-524-1010 or visit lifeguardimaging.com and receive a complimentary heart scan and consultation when you mention Gail and Bloom. Again, the number to call is 813-524-1010. We'll be back with more Bloom right after this.
The preceding portion of Bloom was sponsored by Lifeguard Imaging.
You're watching Bloom, presented by Lifeguard Imaging. Call 813-524-1010 for your complimentary heart scan.
Welcome back to Bloom. Our next guest found his life spiraling from addiction to prison time. He was heading in the wrong direction. But today, he's using his own life experiences as a teachable tool to help others through the Backpack Barber Foundation. Joining us now is Greg Young, a man who's changing the world one haircut at a time. Welcome to Bloom.
Thank you. Thanks for having us.
Well, I'm super excited to meet you and to hear a little bit about your backstory, because it sounds so inspirational how you were able to turn your life around and now you're helping others.
I'm very grateful. Absolutely. It's a very tough road. I grew up battling addiction at a very young age, come from a broken home, and that's when I found my life really spiraling out of control, middle teenage years of being Baker acted, and leading to addiction, hardcore addiction, to jail 15 times. It was just a long, dark road. Felt like a lost soul for many years. Didn't know who to trust, didn't know who to go to, because when you come from a home that's broken, who do you trust? You normally would look to your parents and your loved ones, but for my life, it was mainly trust no one.
Yeah. And then you find your way out of this, and I'd like to hear a little bit about, at what point did you have this moment where you're like, you know what, I need to redirect my life and I need to do something not only to help myself, but to help others?
So I realized that I had a problem. It was clearly evident in and out of jail, multiple situations that resulted due to the use of drugs and alcohol. And my son, who's 10 years old today, is actually my stepson, but he was 3 months old when I met his mother. And I looked at him and I see myself. And I wanted to be able to provide for him and be somebody for him like I needed when I was a kid. I didn't meet my father really till I was about 8 years old that I can remember and know that he was my father. And that really woke me up a lot. My wife brought me to an AA meeting because my wife is in sobriety as well. And she was dealing with the same issues. And that really exposed me to, hey, you have a problem. Hey, you can fix it. And I'm in charge.
That's awesome. So tell me about your backpack initiative and how the whole barber side of it, which I find interesting because you're changing the world one haircut at a time.
Thank you. So basically in 2016, I was able to, I had a couple years of sobriety under my belt. I developed some clarity. I learned to love myself again. And I wanted to give back because it's what was given to me. I'm still to this day forever grateful that God has given me a second chance, basically. And I wanted to give back because I know what it's like to be homeless. I was homeless on and off since I was young, in and out of jail, getting out of jail with nowhere to go, with a pocket full of lint, standing on Broward Boulevard, like, where do I go? that's when I realized that I have my own shop that I opened in 2016. Now I have the platform, the time, and I can afford to put this on my back and try to make a difference in my community, because I felt like it was needed. And it was something that I was very passionate about, because I know what it's like to not have hope. So that's when I stepped out there and said, you know, I'm gonna hit the streets, my backpack, some toiletries and hygiene items, and my clippers, and freshen them up.
And so that's what you do. You go out into the streets, because you know what this is like on a personal level. So approaching somebody on the streets and offering a helping hand, it has to be easier for you than very well-intended people that are trying to help, but they just don't know it from your eyes, from your scope.
So that's one of the main reasons why I did it. I know that I was going to be able to break down a lot of barriers with folks that are living homeless. Because not only was I homeless, I grew up rough. You know, I grew up that street life. I understand different terms in some people. I can break barriers down and get in where I fit in. And I knew that I can make an impact, even if it's one haircut and one conversation at a time. I mean, some people, they're looked at as invisible. When's the last time someone told them that they love them, that they care about them? Like, hey, you have an opportunity. So through my organization, that's what we strive to do. We partner with several different organizations in the city. City of Fort Lauderdale is one of the organizations that I work with as well. And we try to instill opportunities for them to uplift them out of the streets and to take advantage of the opportunities that are there, the resources, the communications, the things that are there to help them.
Well, I am very, very excited about your successes in life, and you are truly such an inspiration. And I think it's really amazing that you're out there helping other people, because you never know, that one conversation could redirect somebody else's life. So we want to give you the information so you can find Greg and support this incredible cause. This could be your way to help. For more information, you can head to the backpackbarberfoundation.com. And I understand real quickly that Greg's going to have a product line that he'll be offering soon that will also, proceeds will go to helping those in need. We'll be back with more Bloom right after this. Welcome back to Bloom. The holidays bring on the baked goods and sweet and savory treats. Joining us today to show us how to sweeten your holiday is Samantha Senavarante, an esteemed baker, cookbook author, food editor, food stylist, recipe developer, and the host of 2 web series. Welcome to Bloom, Samantha.
Thank you so much for having me.
So, Samantha, what are we making today?
Today we're going to make chocolate-dipped ginger macaroons. So that's coconut macaroons, not French macaroons. They come from my first book, The New Sugar and Spice.
Ah, I love it. So it's macaroons, not macarons.
We're correct.
Okay.
Not the French and white almond.
All right, so how do we get started?
So we start with just a couple cups of shredded coconut. And the difference here is I like to use unsweetened shredded coconut, which is a little bit harder to find, but works really well here because then it just doesn't get too sweet. So I have unsweetened shredded coconut, a couple of egg whites, and a little bit of granulated sugar. These are the easiest cookies to put together, trust me. And what I like to add is a little bit of crystallized ginger. So just candied ginger that I've chopped really finely. And I think that sort of makes them more holiday friendly, wouldn't you say?
Yeah, absolutely.
And then we just mix that all together. That's all these cookies have in them. So they're really fabulous.
And this is one of the recipes in your book. And what's the title of your cookbook?
These come from the New Sugar and Spice. That's my first cookbook.
Okay.
But I think you just showed my last cookbook.
So how is your Unchoppable series going?
I think it's going well. I love doing it. I mean, it's cute because we get to make things with the chopped basket, but of course, I don't have to work under time constraints. I don't have to work with mysterious ingredients. So I have it a little bit easier than the chopped contestants do, for sure.
That is great. So once you mix that all together, what do you do next?
So then I just like to scoop it on a parchment lined sheet, and I use one of these fabulous cookie scoops. If you don't have one, I highly recommend you buy one. And then I just put it onto my baking sheet like that in little mounds. And then those get baked for about 22 minutes at 350 degrees. And then they come out like this.
Oh, those look delicious. I wish you were close enough to share. So tell me what's going on with Cook and a Half on Food 52.
Oh, that one is so fun. That's the series I do with my little 4-year-old as my sous chef, and he is a riot. He really likes to cook, but he gets distracted very easily. As you can imagine.
Yes, I definitely can imagine. Fortunately, mine are grown up now, but enjoy that 4-year-old stage because it's super duper adorable. I want to make sure, because I kind of feel like we bounced all over with your cookbooks. You have the Joy of Baking, which was selected as one of the best baking cookbooks of 2019 by the New York Times. Plus your first book, The New Sugar and Spice, was nominated for a prestigious 2016 James Beard Award. So lots of accolades, right?
That's right. Yeah, it's been an exciting career for me thus far. I'm just glad that people are. My favorite thing is to see when people are actually cooking from the book and they tag me on social media, and then I just feel beyond glad that I was able to share my favorite thing with other people.
So what are some of the upcoming projects that you're working on right now?
I have another cooking course coming out with the Magnolia Network. It's breakfast baking, so that should be really fun. We're just shooting tons more Cook and a Half with my son. I don't know, I'm working on my 4th cookbook. That's what I'm going to do right after I hang up with you, get started on some recipes for today. So keeping very busy.
And where do you get inspired? Like, what's your inspiration?
What's my inspiration? Honestly, it's sort of just what I wake up craving. This morning I was just thinking about ginger cream donuts, and I thought, okay, I guess I'll make some ginger cream donuts today. I just think about what I want to eat.
That sounds delicious. Well, I'm going to definitely, 2 of my daughters are coming home from out of state for the holidays. I've got 2 at home, so we love to bake together. We're definitely going to try one of your recipes, that's for sure.
Thank you. I hope you do. And let me know how you like it.
I will do. I'll tag you. Thank you so much, Samantha. And bye-bye. For more information, you can visit SamanthaSenavarante.com and follow her on Instagram at Samantha Senavarante. We'll be back with more Bloom right after this.
You're watching Bloom, presented by Lifeguard Imaging. We begin where your checkup ends. Welcome back to Bloom. With so many Americans living longer, there are opportunities for new careers, better relationships, and larger lifestyles later in life. Our next guest is here to help us reimagine our next chapter.
You really have to think about how are you going to be one step ahead and always reinventing and reimagining who you are. I like to call these kinds of people reimagineers. The other thing is, when you are about to retire, which is a word I hate, it's a very toxic word, I like to use the word rewire, because you're really rewiring how you're going to live the next phase of your life.
Joining us now is Michael Clinton, who is a photographer, pilot, marathon runner, winemaker, and the author of Roar into the Second Half of Your Life Before It's Too Late. Welcome to Bloom, Michael.
It's so great to be with you. Thank you for having me.
Well, Michael, I'm so excited about your book. I just hit 55 last month, and I want this next chapter of my life to be meaningful, and this is what your book is all about. Why did you decide to write Roar?
Well, no, thank you. I mean, first of all, I love to say 55. If you're healthy and you're 55 or 60, you have a really good chance of living another 25, 30 years. And, in the past, as people didn't live as long as we're all living now. And so we have an opportunity to have new careers, new lifestyles, new loves. And so a lot of the realization that I had before I wrote this book is that a lot of what was out there was about winding down. And I wanted to really present winding up. And so I interviewed 40 amazing people who, between the ages of 50 and 65, completely reinvented themselves. And then I put a lot of tools and resources in the book as to how any individual can do that. So it was sort of a refire as opposed to a retire as we think about this long life that we may all have ahead of us.
But Michael, it is scary. I'm not going to lie. You get to a certain age and you start to have self-doubt, way more so than you did in your earlier years. So do you take your readers through ways to overcome these fears and break through to this next exciting chapter of life?
Absolutely. I mean, there is a lot of self-imposed ageism where we say, well, I'm this age and I can't do that, or I'm that age and I can't do this. And, all of that is, a lot of that is self-imposed. A lot of it is culturally imposed. And, we need to have more images of people over 50 who are running marathons and tech savvy and surfing and doing things that people don't necessarily think of. We need more of those role models for everyone over 50 and over 60. But I think a lot of it's self-imposed. So we do walk people through a process in terms of how they can take first steps in whatever area they're interested in. And so, good practical advice as well as the inspirational stories. And as you know, ROAR is an acronym.
Yes, ROAR, reimagine yourself, own who you are, act on what's next, reassess your relationships. So can you walk us through exactly what you mean by that?
Thank you. So the first R is reimagine. And what is your favorite future? And what do you do to create and develop what your favorite future is? And then how do you put that into practical play? The O is own your life where you are now. I don't like the words midlife crisis. I like the words midlife awakening, because at 50, you've lived a good life now. You know who you are, you know what you like. So own your age, own your financial numbers, own your health numbers, own your last age, go to 90 and work backwards. What is it what is your legacy? What have you contributed to the world? The A is the action plan, and lots of great ways that you can really take this step by step. As you said earlier, it can be a little daunting at times. And the R is reassess your relationships, because the people around you are going to be the ones that are going to help facilitate you to get there. So your relationships with your family, your friends, your community. And so it's a four-part process that is there for people to sort of think about different ways to build out a second half of their life.
I love that. And I know that you're not really a big fan of 50 is the new 30 or 60 is the new 40. You believe we should own who we are right now.
Right. Yeah, I mean, I think I love to say 60 is the new 60 and 70 is the new 70. And we have lots of role models now. If you think about, Jennifer Lopez and what, in her 50s, and you think about Sting, and, I know that the Rolling Stones were just in Florida playing, and now they were in Dallas a couple of nights ago. And Mick Jagger, 78. And so, own your age and create role models where we show people who are proud of 60 is the new 60. And so, yeah, I like to, that gives people confidence to move forward and constantly do things in their lives.
And Michael, I love the tagline of your book, Before It's Too Late, because now is the time to take the reins of your next chapter of life.
Yeah, I mean, oftentimes people will say, well, I'll figure it out when I get there. When I retire from my first career, I'll figure it out when I get there. And the message here is you can start building parallel lives and parallel thoughts for a new career, a new hobby, turning it into a business, service to your community. But start thinking that through. Most of the people all the people actually that I interviewed, they all spent a good year to two rethinking and constructing how they were going to move forward when they were going to make a change. And so you have to put in the work to do that. And when you do that, you can segue into the next chapter of your life in a really nice way.
And yet, Michael, we heard in a quick video clip of this interview that you do not like the word retire. You replace it with rewire, right?
Yeah, totally refire. Refire into what you're going to do next. I talked to a lot of people who left their first career after 30 years and then completely reinvented and said, I'm going to have another career, but it might only be 10 years. So refire into that 10-year period. And you may have a third career, for another 10 years after that. What are some of the things that you left on the shelf when you were a younger person that you really wanted to pursue and you didn't? Go back to that thought and think about, how do I re-engage and reconnect with myself on that front to create this new refire, which is really the language that we use in the book. Yeah.
Well, Michael, I am so excited about the book, and of course for you joining us on Bloom. Thank you so much.
Thank you so much. It was great to be with you. Thank you. Keep roaring.
Thank you, Michael. I will roar on. And Roar Into the Second Half of Your Life is available wherever books are sold. We'll be back with more Bloom right after this. Welcome back to Bloom. The number of kids vaping in our country is reportedly skyrocketing, and now we're finding out vaping isn't just bad for lung health, it can have a major impact on our brains. Joining us today is Dr. Jasmine Reese, the director of the Adolescent and Young Adult Specialty Clinic for Johns Hopkins All Children's. Welcome to Bloom, Doctor.
Thank you so much for having me.
So we hear all the time that smoking is bad and vaping is bad for the heart and the lungs, but the damage it does to the brain often gets less attention than it should. Can you talk to us a little bit more about the impact it has on the brain?
Absolutely. Yeah, and you're exactly right. We often give a lot of attention to the respiratory effects of smoking and tobacco products and those harmful effects, but we have to remember that these products and these chemicals really do affect other parts of the body, and that includes the brain. So some interesting information we have learned over the years and through research is that one's likelihood of developing dementia and Alzheimer's increases pretty drastically. So you actually have a 30 to 40% higher likelihood of developing dementia and Alzheimer's if you are a smoker. And so that's really important for somebody to consider, because you think about other risk factors that an individual has, including age or other medical history that they might have where they already have an increased risk, plus smoking can really add to that.
And speaking of age, we know that vaping is very popular among our youth. It's frighteningly popular. And I think a lot of them might think, hey, vaping's better than smoking cigarettes, and they can do it without really taking on a lot of notice. Does vaping have the same impact on the brain like you're talking about with adults?
Absolutely. So vaping is still considered a tobacco product. Those vape products do have nicotine, and we know nicotine for young people certainly affects their brain development. Young people, their brain is still developing well into their mid-20s. So it is really important that they understand that this is not harmless. Although they may feel good in the moment, they don't feel these sudden effects very quickly. These are effects that will happen very gradually and over time. So the more that you vape, the more this is really going to affect that brain development, and that's going to include learning, processing, memory, concentration, and focus. I have a lot of teens who might come to me and ask, I think I might have ADHD or inattention, focus issues. And then I learned that they are vaping, especially quite a bit. We know that one vape pod is the equivalent of about 20 cigarettes. That's a whole pack of cigarettes. And so imagine if they're using or vaping more than one pod in a day. I mean, that's a lot of nicotine, a lot of inhalation of these chemicals and compounds that are really harmful to their brain and other parts of their body.
And for many parents, it's not like a cigarette where you can smell it on someone's clothes or smell it on their breath. It's very difficult to know if your child is vaping. So what's the message that you're trying to get out to parents and of course to youth that are taking on this habit?
Right. I think it's really nice that we don't smell that chemical. And that's one reason why people think maybe this is less toxic or less harmful than the traditional cigarette. But really, we're thinking about something that is now becoming an aerosol. Other compounds and toxins are now getting introduced into the body and affecting different parts of the body. So although you can't smell it, it doesn't mean that it's safer. We don't have any research to support that this is safer than a traditional cigarette. And so for parents, really asking those questions about, what is going on in school, letting them know these kinds of effects. Teens are not thinking about dementia and brain development, but it is important for them to understand, like if they are struggling with concentration, focus, maybe asking them those questions. Have you ever experimented with this? I want to have that honest conversation. The other thing is that we know mental health has been a huge issue, especially over the last couple of years. A lot of teens struggling with their mental health. And sometimes vaping and using these products is a way for them to deal and cope with those emotions. So even questions about how they're feeling with their mood. But also, again, reminding them that other parts of their body, even their heart can be affected. Their blood vessels are affected. We know from the American Heart Association that they have increased risk of cardiac disease and stroke, and that can severely be reduced if we don't smoke at all, and certainly if we quit smoking.
All right, Dr. Reese, thank you so much for joining us on Bloom today. I really appreciate it.
Thank you so much.
For more information, you can visit heart.org. And remember, 2021 Tampa Bay Heart Walk is coming up Saturday, November 21st, and you can be a part of WFLA News Channel 8's Stacy Scheibel's team. Visit WFLA.com/heartwalk for more details. We'll be back with more Bloom right after this. Welcome back to Bloom. Just ahead of Veterans Day, the Department of Veteran Affairs is expanding disability benefits for toxic exposure from the past 30 years. In today's Military Monday segment, we are joined by the Department of Veteran Affairs' Beth Murphy, who is the Executive Director of Compensation Service. Welcome to Bloom, Beth.
Thank you, Gail. I appreciate you helping to get the word out.
Absolutely. We're excited to do so. For folks out and watching right now, they might be saying to themselves, I'm deployed, I have respiratory issues, but I'm not sure of my diagnosis. Can I file a claim?
So we are encouraging folks to file a claim, and let me tell you what that means. We've just added 3 new respiratory conditions, and they are chronic asthma, sinusitis, and rhinitis. And we presume that those conditions, if you have them, are due to exposures to airborne hazards, particulate matter, in the environments if you were deployed. And the locations are in the Southwest Asia Theater in August 1990 to the present, or if you served in Afghanistan, Djibouti, Uzbekistan, Syria, from September 2001 to the present. So if you were in one of those locations, we presume that you were exposed to particulate matter in the air. And if you have developed one of these 3 chronic conditions, we're making that presumptive link. We're granting those benefits and entitlement to health care because of that.
So not everybody is eligible for the new presumptive service connections, but it seems like the net has been cast a lot wider.
That's correct. So this could affect an estimated population of up to 3.5 million veterans. So there are a number of folks out there who could definitely be eligible, and we're encouraging anyone who thinks they might be entitled to apply, file a claim.
Yeah, this is very exciting news. What are the conditions that the VA is examining for the presumption of service connection based on exposures to particular matter?
So if you served in one of those locations, and like you said, we are presuming that there were these environmental exposures to particulate matter in the air, and if you have developed either any of these 3 conditions, chronic asthma, or sinusitis, or rhinitis, we've connected those dots. Those are presumptive now, and we're paying those claims since just August. We've processed over 4,000 claims and paid millions of dollars to eligible veterans, and opened up entitlement to health care. So we encourage folks to come in and apply. Even if you're not quite sure if you have one of those conditions, if you've got a respiratory something going on and you think it might be due to your service in those locations, we encourage you to reach out to us. We can answer your questions. We can help you file a claim.
And quickly, Beth, we have about a minute left, but I wanted to ask you, for veterans who've applied for a claim and been denied in the past, do they need to reapply?
Yes, for these 3 conditions, if you've been denied in the past, since this is a new basis for eligibility for presumptive service connection, We are asking you to come in and reapply with a supplemental claim. There's a form for that. It's VA 20-0995. Importantly, we have already sent outreach letters to those that could be affected, and invited them to come in with their questions, or more importantly, with their supplemental claims.
Well, thank you so much, Beth, for coming on and sharing details for our veterans. We really appreciate it, and those deployed.
Yes, thank you very much, Gail. And please ask your folks that are listening to come to us on va.gov or call our toll-free number 1-800-827-1000. Thanks for having me on your program.
Thank you. And we'll be back with more Bloom right after this.
Content segments during Bloom were paid for by Millennium Physician Group.
Call 813-524-1010 for your complimentary heart scan. Medical Minute is sponsored by Millennium Physician Group.
A bad night's sleep could be a sign of something more serious. Sleep specialist Dr. Faria Abbasi-Feinberg explains how recognizing and treating sleep apnea are easier than ever.
In sleep apnea, when you fall asleep, the muscles in the back of your airway basically just close off and collapse. You end up not getting enough oxygen in, which over time can cause damage to the heart and to the brain.
Sleep studies are used to diagnose sleep apnea. They record the number of episodes of slow or stopped breathing detected in an hour. They also determine if blood oxygen levels are lower during these events.
Now, in the past, you would have to come into the sleep lab and spend a night there. Nowadays, we mostly use home sleep apnea testing. It makes it much, much easier for the patients.
A diagnosis of sleep apnea doesn't always mean a prescription for a CPAP machine. For mild cases, some of today's treatments are much more patient-friendly than in the past.
There are oral appliances that are FDA approved for people that have sleep apnea, and it basically moves your lower jaw forward and out a little bit, and it keeps your airway open.
These oral appliances have been shown to improve symptoms of sleep apnea, including daytime sleepiness, moodiness, concentration issues, and snoring. For Inspiration Health, I'm Liza Fernandez.
Medical Minute was sponsored by Millennium Physician Group. Thanks for tuning in to Bloom today. We always want to hear from you. Send us your questions or topic ideas to email address bloom@wfla.com. Plus, make sure you follow Bloom on social media, Instagram @Bloom_TV, Facebook @Bloom TV Show, and Twitter @Bloom TV1. We hope you'll tune in again on the next Bloom presented by Lifeguard Imaging. We'll find out how divorced families can have happy holidays. And we'll hear from a Tampa fibroid patient who found relief through a new treatment. Plus, we'll learn how to live our best life despite the cards we're dealt. Stay healthy, and we'll see you next time.